Hi, my name is Amy Crum. I'm one of the social workers that work here at Florida Hospital Transplant Center, and part of your evaluation you will be meeting with the social worker. We'll complete a psychosocial assessment with you. We'll ask you some questions and provide education and resources for you. One of the things we'll be talking with you about is your support system. We will ask you who's going to help you post-transplant and drive you to all your appointments. As you know, you will need to come to the transplant center 3 times a week for the first month, twice a week for the second month, and once a week for the third month. You will not be able to drive for several weeks. And in your packet, you will see a transportation caregiver form that must be completed and signed by your caregiver and transportation providers. We cannot clear you for transplant unless you have this form and complete it for us. We do not recommend public transportation due to germs and infections. We'll also talk with you a little bit about your compliance, and it's important for you to remain compliant with dialysis so you stay healthy. Also, by staying compliant with dialysis, it demonstrates to us that you're serious about transplant and you will take care of the new kidney. Every patient will receive a drug screen when they begin transplant evaluation. If your drug screen is positive for an illegal substance such as cocaine, marijuana, and methamphetamine, you will be placed on hold and required to complete substance abuse counseling. We will drug screen you every year up until time of transplant. You will be asked questions about how you're coping with your illness and dialysis. If you have depression or anxiety, please get it treated. Many dialysis patients have symptoms of depression and anxiety. This is very normal. Many are taking antidepressants and anti-anxiety medications. Please tell us which ones you're taking so we can be sure to restart those after transplant. Sometimes we do require a patient to get a psychiatric clearance before we can clear them for transplant. You will lose your Medicare and Medicaid 3 years post-transplant if you are receiving those benefits due to kidney failure and dialysis. The government considers transplant a rehabilitation, and you are expected to return to work and obtain private insurance. If you're 65 years or older, or you're disabled for something other than kidney failure, you will keep your benefits. If you look in your folder, you will see a packet of resources. These resources include our support group, which meets once a month, and you're more than welcome to bring your family or friends with you. There is also information on fundraising and the Ticket to Work program. Please remember to take care of yourself and remain compliant. Stay engaged in life with activities, hobbies, work, family, and friends. We look forward to meeting with you soon.